Well, the main medical approach to anything is to find a drug to fix the problem. Doctors are taught to look for disease. That's a part of your training from day one in medical school. So, like a detective work, you ask. In the case of depression, you're asking, quizzing the patient about their symptoms, and that's the focus to find out whether there's symptoms or not. And if the doctor then thinks, okay, this person's depressed, quite often antidepressants will be offered more often than not. In fact, there was one study that showed if a patient went in and mentioned a particular antidepressant by name, they were 17 times more likely to walk out with a script for an antidepressant than if they didn't mention the name of a drug. So the bias of doctors generally is to say, okay, well, let's put you on a medication to fix this.
Welcome to Linda's Corner, where we bring more hope, healing, and happiness to the world. My name is Linda Bjork, and today we're going to be talking about sticking it to depression. I'm delighted to welcome Dr. Alex Joannou. Dr. Alex is a medical doctor, university lecturer, and medical student trainer, author, and the developer of Transformational Acupuncture. You can reach Dr. Alex at his website, and I'll include a link in the show notes. Welcome, Dr. Alex. I'm so glad that you could join with me today.
No, thanks, Linda. My pleasure.
Thank you. Thank you. So today we get to talk about depression. And if it's okay, let's start about the standard traditional way that people treat depression. And then after we kind of had an understanding about that, then we get to learn about what you do that's different.
Mm-hmm. Fair enough. Yeah, well, the main medical approach to anything is to find a drug to fix the problem. Doctors are taught to look for disease. That's a part of your training from day one in medical school. So, like a detective work, you ask. In the case of depression, you're asking, quizzing the patient about their symptoms, and that's the focus to find out whether there's symptoms or not. And if the doctor then thinks, okay, this person's depressed, quite often antidepressants will be offered more often than not. In fact, there was one study that showed if a patient went in and mentioned a particular antidepressant by name, they were 17 times more likely to walk out with a script for an antidepressant than if they didn't mention the name of a drug. So the bias of doctors generally is to say, okay, well, let's put you on a medication to fix this. So that's
on the one hand, saying, okay, I'm going to be Sherlock Holmes and I'm going to try to find out what the problem is so that I can solve it, sounds brilliant, except it's not actually solving the problem.
Yes.
What we're hoping to do is to solve the symptoms, to eliminate the symptoms. And that is, I think, part of the distinction about looking for today.
Yeah.
And also the desire, I would love the idea of just give me a pill, I swallow, and I am all better.
Yes.
And if it worked like that, like I want it to work, sweet. But it doesn't actually always work out that way.
No, it doesn't. The thing is, I guess, depression, along with all mental illnesses, are actually classified as disorders rather than diseases. But mentally, I think doctors still treat depression as a disease. And yet there's no pathology that you can find, no blood test or X-ray or imaging that will show, okay, this person's got depression. It's purely based on the conversation the doctor's having with the patient, really. And so you put somebody on an antidepressant, and you can measure these things by various scales like the DAS scale, which is Depression, Anxiety, Stress Scale. And it's just a questionnaire to ask the person how they felt over the previous week. And the thing is, if the score comes down, well, that means they're less depressed. But it doesn't mean they're actually happy. So a doctor's looking for signs that their person's less depressed, and hopefully they're not depressed, but they're not looking for signs that the patient is happy. If you know what I mean? There's a world of difference between being not depressed and being happy.
And Dr. Alex, the distinction that you made is so huge. I have a friend currently struggling with some depression, taking the antidepressants. And when you ask him, is it working? He says, I'm not happy.
Yes.
And there is a common misunderstanding that taking an antidepressant is a happy pill.
Yes, exactly.
Depression is
and it's not.
That deep, deep hopelessness and sadness. And so it seems like a pill would make you happy and hopeful. But that's not the purpose. It's I loved how you described it is to raise that score. Let's be less depressed.
Yes, yeah, exactly.
And I think that matters. I think medication is wonderful and it absolutely has a place. But I do think there's a huge misunderstanding of what it does and what it is supposed to do. And so that's important, I think, when knowing and understanding when you go into it, say, when I get my prescription for my antidepressants, the goal is to be less depressed.
That's right.
And if you understand that and you're okay with that,
that's
sweet. But if you're looking for something else, like happiness, then
the best the pill does is to keep you comfortably numb. It's one way of describing it.
Okay. Yeah. Okay. Which is better than miserable, gotta say.
That's right, exactly.
So let's say I'm Dr. Alex, I'm struggling with depression, and I am not satisfied with just being less depressed. My personal goal is I would like to be happy. Is there something that I can do?
Yeah, well, I'd certainly advise you to try acupuncture personally. I've been a medical doctor for over 40 years and doing acupuncture for 25 years. And around about 12 years ago, I was playing around with a new form of acupuncture, which is used to align the chakra energy rather than the traditional Chinese approach. And that's when I started noticing not only was I fixing their problems that they were presenting with, but they were walking out feeling happier. And it became very obvious after a while that a lot of patients were saying, I don't have arguments with my wife anymore, or I'm a lot happier in my work. There's still the same issues and problems at work, but it doesn't bother me. And I go home feeling happy. So my wife who's also a doctor at our practice, kept nagging me to try and measure these things, see what's going on. And I just kept saying, well, I know the acupuncture works. I've got so many happy patients. But there was one particular patient who really changed everything for me. She presented with osteoarthritis, pain in the joints, quite widespread in the hips, knees and hands, wrists. And her other doctor, who is a doctor in the practice, had put her on opioids to try and manage the pain because it was getting that severe. And so I said to her, let's try some acupuncture. Can't do any worse than what you're doing, because she wasn't happy being on these drugs. And then I started the acupuncture, and within 3 weeks, she got off the antidepressants. The painkillers, the opioids, because she felt the pain had improved dramatically. She was just using occasional Panadol. And I kept going for a while to try and see how good I could get her condition. And after a couple of months, she said, can I stop my antidepressants? So I said, tell me more about that. And she said she had been on antidepressants for 16 years. And I thought, well, maybe she just didn't need it anymore, but just kept taking it because she's been told to take a pill. But I checked through the notes, and the previous year, another doctor in the practice had tried weaning her off antidepressants, and the depression came straight back. So she was put straight back onto the dose. But this time I said, okay, well, she scored as being normal on the depression, anxiety, stress scale. So I said, okay, let's try weaning you off the antidepressants. And did over a space of about a month. And this was just before Christmas. And she had some Christmas carolers knocking on the door, singing Christmas carols, and she burst into tears. But it was tears of happiness. She just felt this such joy leaping up from her heart. And she had said she hadn't felt like that for she couldn't remember how long since she actually felt such a positive emotion. And, so when I told my wife this, she says, you've got to study this, you've got to measure this. So then I followed a half a dozen patients over the next year with diagnosed depression and monitored them, and they all improved to the point where they didn't need medications anymore. And I did follow-up calls a year later. One particular patient had been depressed, though she presented with migraines as her issue. But she'd been quite depressed and tried various antidepressants, which she didn't like the effects of them. And she tried biobalance, which is natural therapies, mega doses of vitamins to help. And she was sick and tired of taking a whole lot of pills for her and felt that it just held her there. And she had also tried traditional Chinese acupuncture and said that, it helped a little bit with the migraines temporarily, but wasn't a cure. And so I started treating her, and within, I think, 4 treatments over 4 weeks, her migraines basically had stopped. And then she started talking about her relationship with her husband, and they had made what's in Australia we call a tree change, which means you move from the big city, the big smoke, out into the countryside to live a nice, quiet rural life. And they thought that'd be a great place to raise their kids. But instead, the husband had to work away from home and she was lonely, and they never felt they could talk to each other, it turned out, because they thought, I don't want to take the other one's dream away from them of living in the country. And the kids' grades at school were dropping and so forth. But with the acupuncture, the thoughts came to her mind, and she raised the courage to raise it with her husband. And he says, well, I thought you wanted to be here. That's why we're doing it. So after a few more weeks and discussion, they actually ended up deciding to move to Europe, which was where his family lived. And she was really happy enough any treatment before she left Australia. And I rang her a year later, and she said she was having a ball. In the country, she was just doing farm work, except her symptoms were so bad with the migraines that she could only get out of bed to take the kids to school, and that's it. And then get out of bed later in the day to pick them up from school. And that was the extent of her life. And she was a trained lawyer, and she had no use for her skills in the country where she was living. So, but when I rang her a year later, she got a job with a non-profit organisation, an international organisation, where she was using her skills. And she said the kids were going great at school, their grades had really improved, and that she was just about to go out for dinner and go to the opera with her husband. So she was living the dream. And that was after being in this stuck, depressed, gloomy place for so long.
Wow. I love things that work.
Yes.
I love things that work. I
Yes.
love things where it's not just coping, it's not just managing, but it's that transformation
Yes.
to go from that hopeless, horrible misery, which I have experienced, and it stinks, to a place of happiness and joy. And that is fantastic. And I love that there's more than one way to do things.
That's exactly right.
I appreciate you being willing to share something new.
Yes.
Now, with your thing of your particular method of acupuncture, I would love to learn a little more. So traditional Chinese acupuncture, can you tell us a little bit more about that? You said that your style is aligning the chakras.
That's right.
Teach me.
I mean,
it's new territory.
Yeah, well, in short, I mean, the two systems, the traditional Chinese medicine and the Hindu system of Ayurveda, developed parallel over the last 2,000 or 3,000 years in countries that aren't that far away from each other. Yet there's no crossover, it seems, between the two. I mean, Hindus talk about prana and the Chinese talk about qi, but the concepts are the same, like energy moving along channels. And And it turns out, really you can identify which particular acupuncture points correspond to the 7 chakras. And therefore you can use acupuncture to manipulate that chakra energy and shift things. So I've developed my own questionnaire, which is sort of 49 questions based on 7 questions relating to each of the chakras. And from the score of that, I can work out which chakra needs supporting the most. So whether they've got issues of security and safety, for example, with the root chakra, or whether it's their connection with the divine is cut off with the crown chakra, then I work on those areas appropriately. And, week by week, I can see the scores coming down and the patient feeling the improvement. So, yeah, it's...
And you've had lasting change over a period of time of 4 weeks.
Yes.
And visiting.
Yeah, well, usually I start off with 8 treatments over 8 weeks to sort of, most people will feel an improvement, some dramatically, but most people feel an improvement. And then depending on how long the effect lasts, because often acupuncture, when you give it initially, people can feel good for a couple of days and then it feels like they're going back to the same way. But it's like you're training the energy to flow a different way. So repeated treatments, the effects last longer and longer. When they feel good for the week, then I say, let's come in fortnightly. And when they feel good for the fortnight, then we'll make it every 3 weeks and so on. So some people just come in once every, 3 months or so for a treatment, tops them up, keeps them going.
I appreciate that understanding. I appreciate when it is something that has a beginning and an end, if possible. Mm-hmm. I mean, maintenance, occasional is whatever.
Yeah.
I have to come twice a week for the rest of my life so that I can feel good. And I just change pills for needles and it's not really any different. So the idea that it's solving and correcting.
Yes. Yeah. Well, that's the beauty of it. Often during treatments, people have, clarity of mind to actually see things or hear things, get a message, which whether you interpret that message as coming from God or from your higher self, it's up to your own religious beliefs, I guess, but it can be quite powerful. I had one patient who came to me because she had a foggy mind and was concerned about her weight gain, and she was lethargic. Now, the thing was, she was drinking quite heavily, and this was another lawyer, actually, and what was happening is that she was medicating with alcohol at the end of the day to calm herself down, and then she needed a lot of caffeine the next morning to pick herself up, and that obviously is not sustainable for a long, long time. But during the treatment, I was trying to be non-judgmental about the alcohol, and my words were fairly brief, just getting the information out of her. But at the end of the treatment, she said, I realised I've got to stop the alcohol. And the thing is, it comes from within, and therefore it's a whole lot more meaningful than if somebody just tells you to cut down the alcohol. Mm-hmm. So she did. And then when she came back for her second treatment the next week, she said her brain fog had actually cleared and that she'd lost 2 kilos in the week because she wasn't having all the calories and probably less inflammation. So your body tends to get rid of fluid. So, so I gave her a few more treatments, but she didn't need many more to get her on the right path, really, because of that commitment to making that decision.
That sounds amazing. And in my mind, I keep thinking about the root chakra and safety. People who struggle with anxiety, people who struggle with just feelings of, a lot of people are filled with fear. So to be able to correct that would be monumental.
Yes. It often people get a release of emotion which can happen during the treatment. Like I literally will stick a needle in a particular point and then they'll suddenly burst into tears or cry out. And it's often, it's not related to how painful the treatment is. It's just that release of emotion that's been stuck. And that particular incident happened to one of my patients. And then this was her first treatment for depression. And she said when she was driving home that day, she found herself singing along to the music in the car. And she said She couldn't remember how long ago it had been since she sung, because she used to like singing. But that joy sort of spontaneously comes out once you can release that emotion. And depression, a lot of depression is about feeling stuck.
Yes. That is a very stuck, nasty feeling. That is amazing. So you also, because this sounds like, I mean, as we're talking, I'm like ready to schedule an appointment, but I have a little problem in that I am in the United States and you're in Australia.
That's right.
So you are also teaching and training at university, correct?
Yeah. Well, I've off my own bats, I've been training acupuncturists in Australia for the last 3 or 4 years, because I come to the realization where I couldn't even treat the number of people in the little town I live, just because of the sheer number of people with depression. So I thought I'd need to train others in this method, and I've been successfully doing that in small group workshops. And but I thought I've been playing around with doing it online, so I've been doing online for the last 3 months, and finding that they're getting equally good results with their patients. So that's really find it very exciting. I've got one client who's an acupuncturist in Canada, and after the very first session, I do it as like a weekly session over a couple of months to teach them the method. And after the very first workshop, she treated a patient the next day who was 94 and had chronic pain and insomnia. And so she gave her the treatment I recommended, which I teach everyone to do for the start. And she said the patient rang her the next day and was excited, because she said she woke up without pain for the first time in 20 years, and that she had slept through the night. And since then, I've found out that she's going ahead leaps and bounds. So that's I find it really exciting that I can, through the marvels of the internet, teach someone this method, and they can then reproduce the effects with their own patients.
Yes, because as you mentioned, one person, you can become overwhelmed with just one small town, and have a whole world filled with
280 million is the latest estimate.
Yeah.
Which means not only 280 million people, but 280 million families, and then obviously the workplace and so on.
Wow.
So that's an insane number of people. But there's a lot of acupuncturists in the world.
That's true.
50 or 60,000 that I know of. So it's just a matter of trying to reach out to them and get them to learn this method.
Yes. And I'm so glad you're teaching others. I love things that work. I am all for things that work.
Yes. And it's often the place where doctors get stuck, because I try to tell doctors about this, but it's like, how does it work? How could it possibly work if it's based on some myth, based on, medicine 2,000 years ago, before there was any science? Well, but to me, I've always been practical minded. Maybe that's why I went into general practice, where you use anything at your disposal to help someone, because that's ultimately what counts. It's not a matter of whether it fits any nice theory or not.
Isn't that nice? And because you have the general practitioner, standard medicine, and the other, isn't that a wonderful example that not all of our doctors are closed-minded? But typically, we believe what we have been trained. We believe what we have been trained. And sometimes that's as far as we're going to go. And I love that you brought up, we can only use the tools that we believe in. We can only use the tools that we are open to, that we trust. And if we're closed-minded and we can only accept one way, that's okay. Then you have to be happy or satisfied with the results that you're getting. And if you are, that's great. But if you're not, then in order to find some other help, we have to open our minds a little bit and say, well, here is something. And I love that you mentioned before, it's not going to hurt. as
That's
far
right.
as there aren't side effects. I'm not going to come out worse off physically, mentally, emotionally, or whatever for having tried this than if I didn't do it. So the very worst I could get is nothing. And the best I might get is a transformation.
That's right.
That's a pretty good risk tolerance to me. I mean, where it's like, well,
the risk
here's
reward
the negative and here's the positive reward. That's what I'm looking for.
Yeah. I mean, I did have one patient who had looked after for many years as a GP, and as I shifted into the acupuncture, she was straight down the line, Western medical. She was in the mid-80s now. Now, the thing is, she developed throat cancer and had to have major surgery, and it was terrible side effects for her and radiotherapy, and the side effects was really painful dry mouth, and it was really getting her down, the constant symptoms day in, day out. And she was caring for her husband, who was about 10 years older, because he was, had some Alzheimer's. But she wasn't really coping. And I'd see her in the waiting room, waiting to see the other doctor. And I said, just try the acupuncture. And she'd go, no, I'll trust the doctors. But after a while, I could see it was really getting her down. And she was unkempt, and the doctor had tried her on antidepressants as well as the opioid painkillers. And she said, well, maybe I'll give it a go, like, what's the minimum I can do? I said, well, let me do 8 treatments over the next 8 weeks. Just let me. And, and it was just the fact that I guess that I was a doctor and known to her that she trusted me to do the acupuncture, which, once they experience the needles going and they go, oh, is that all there is to it? It's not painful, or there's no woo-woo involved. And but the thing was, over those 8 weeks, she had a dramatic shift where, she was able to stop the opioid painkillers and stop the antidepressants. And you could see she was her old self again. When she came in, she was dressed up and taking care of herself with makeup and all of that. And she was fully in charge again and looking after her husband and so on. So it really, she just kept saying, I'm so amazed. I can't believe this happened to me. This is just amazing. And and that's lasted. She hasn't had to come back for further treatment. She was just going to do those 8 treatments, like I said.
Wow. Well, I'm so happy that she was willing to try something new. Sometimes a little bit of desperation is what it leads, is what it takes to say, okay, I'll try something. I'll try something. And I was just waiting to see, and what results did she get? And so I'm happy that it worked out for her.
Yeah.
Awesome.
Oh, yeah, absolutely. And, most people will get some degree of improvement in whatever, chronic pain is probably the number one problem most acupuncturists treat. But the thing is, a large proportion of those people have depression as well, because chronic pain makes you depressed. It's just nagging there day in, day out. And on the other hand, if you're depressed and you get some kind of injury, then it's more likely to turn into a chronic pain. So the two go together. So most acupuncturists around the world, the top 2 presentations are chronic pain, depression. And this can address both of those things.
Wow, that's huge. Okay, so if I'm interested in finding someone who practices not just acupuncture, but your version of acupuncture that aligns the chakras, is there a website I can go and find a practitioner near me? Where do I go?
Yeah, well, stickittodepression.com is my website. And I've got a list of certified practitioners, which at the moment is just Australian acupuncturists, but I've just finished training some Canadian acupuncturists. So if you're close to the border, maybe worth going across the border. But I'm hoping to get some American acupuncturists on board with this. So that's part of the reason for reaching out, because I need to spread the word. Oh, it just feels like that, I don't know if it's evangelical, but the thing is when you see people suffering, and I think, just give me a few weeks of treatment and I'll get you better. I did go to Canada recently, and how I got the Canadian acupuncturist, because there was a friend of a friend with depression and had been on antidepressants for literally 18 years straight. They tried all sorts because of getting side effects, but was still depressed. And in fact, I scored him and he rated as being moderately depressed and severely anxious. And because I was only there for a short time, I literally gave him 6 treatments in 6 days. And on the 7th day, measured his scores, and he scored as being not depressed and not anxious, and felt the best time he could remember in a long time. And, I wouldn't say that's a cure, but it just shows you how quickly you can shift people's mental states.
That is amazing.
Yeah, I mean, and if I was there longer, I'd be, saying, well, let's try it weekly for a while and start weaning you off the antidepressants, because, it obviously wasn't solving his problem, really. It was only just keeping him in a holding pattern.
And a lot of people feel like, well, this is as good as it gets. This is
which is very sad.
There is no hope. There is no cure. There is no anything. So to offer that hope that here's something else you can try.
Yes.
Oh, that's amazing. Oh, wow. Dr. Alex, this is incredible. Is there anything else to make sure we cover before we close today?
Well, I was just going to say, I mean, if you have any listeners who are acupuncturists, or if they go to an acupuncturist, perhaps they could direct them to my website, stickittodepression.com. And if they click the button Start Here, it follows through with some questions, and then I'll be in contact with them because I'd love to work with some acupuncturists over there, because I know it works on Canadians as well as Australians. So I'm sure it'll work on Americans as well.
I think we're all human beings, so hopefully
exactly.
Some similarities there.
Yes.
Fantastic. Well, Dr. Alex, thank you so much for joining with me today.
Thanks, Linda. It's been a pleasure.
In closing, I'd like to share a quote by Andrew Weil. He said, "The World Health Organization has recognized acupuncture as effective in treating mild to moderate depression. If you're struggling with depression, I invite you to investigate a variety of methods of healing so you can find something that works for you." See you next time on Linda's Corner.
Thanks for listening. Please share and subscribe to help us reach new listeners. And if you'd like to heal your life from the inside out, there is a free video series at hopeforhealingfoundation.org. Just click on the Free Stuff tab. I also invite you to grab a copy of one of my books, like Crushed, A Journey Through Depression, and You Got This, an action plan to calm fear, anxiety, worry, and stress. See you next time on Linda's Corner.